Assalamu alaikum. I am Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine. Welcome to today's session. Today we are continuing the previous class of abortion. As we define abortion medically, the expulsion of the product of conception from the gravid uterus at any period of gestation before the full term. But legally, abortion means premature expulsion of the fetus from the mother's womb at any time of pregnancy before full term of pregnancy is completed. As mentioned in obstetric conception, abortion is within the first 3 months of conception, that within 12 weeks, but miscarriage is in between 4 to 7 months, that is 16 to 27 weeks. The term miscarriage is synonymous with a spontaneous abortion. There are certain terms related with the abortion, like as abortus. The non-viable product of abortion is called abortus. Abortifacient means the agent that induces abortion is called abortifacient. Unsafe abortion is abortion not provided through the approved facilities or any approved persons. Fabricated abortion. Rarely, when a woman is assaulted, she may try to exaggerate the offense by alleging that it caused her to abort the conception. She may acquire a human fetus or an animal fetus to support the charges against a person and bring the charge of blackmailing. As the classification of abortion, the main two classification are natural and artificial or induced abortion. Natural abortion, as mentioned, spontaneous abortion and accidental abortion, as well as the induced abortion, justifiable abortion and criminal abortion. More than 10% of the abortion cases are spontaneous, and rather than there are an act called medical termination of pregnancy. Some induced abortion that are out of this range of medical termination of pregnancy will be regarded as criminal abortion. Now, in case of abortion, there are some factors concerning the fact, like the consent of the female or the pregnant woman. If the female is above 18 years of age with sound of mindness, she can give consent for medical termination of pregnancy. That is a legal term. Consent of the woman will not be necessary if she is underage, that is under 18. In that case, she will be considered with the guardian or her parents with this. And in case of a married woman, there are not necessary of the husband's consent. Now, today's topic will be in emphasis on criminal abortion. Any abortion that is deficiency of one or more of the profession will amount to criminal abortion. It is the induced destruction or expulsion of the fetus from the mother's womb unlawfully when there is no therapeutic indication for this operation, like as the therapeutic conditions or humanitarian conditions or certainties. It is restored to mostly by the widows and the unmarried women, usually carried out before the 3rd month. A case of criminal abortion is investigated only when the woman dies or rarely when someone gives information to the police regarding the fact. Now, the prime concern from this criminal abortion is the motive. What will be the motive in case of criminal abortion? To get rid of a child following the illicit intercourse with a view to avoid the shame and disgrace of the person, specifically the widow, unmarried girls or married women conceiving during long absence of their husband or living separately from their husbands. Also, to prevent inconvenient addition to the family like poor socioeconomic conditions, the heir presumptive may procure abortion of the female whose husband's property is inherited in absence of her child. The certain differences between the natural abortion or the spontaneous abortion with the criminal abortion, like as the predisposing disease will be the natural abortion causing. In case of criminal abortion, the motives. In case of injuries to the genital organ, there will be marked injuries in case of criminal abortion, where the natural abortion will have none. Mark of violence on the abdomen as well as presence of foreign body in the genitalia will be absent in natural, but will be present or may be present in case of criminal abortion. Fetal injuries will also be present in case of criminal abortion, which is absent in natural abortion. And the rare fact that the toxic effect of the drugs will be present in criminal abortion, like as the using of the abortifacient drugs, and infection is common here. The methods adopted to perform an abortion is using abortifacient drugs that are prepared in second month of pregnancy, use of general violence and specifically local violence. The drugs that are used for abortifacient as ecbolics that are ergot that causes uterine contraction as ergot preparation, synthetic estrogen, pituitary extract, even strychnine or quinine. Immunogogues that are the estrogen, borax or savin that increases the menstrual blood flow. Drugs that act on the genitourinary system that are cathephrines, oil of terpenes, oil of tansy, etc. Drugs acting on the gastrointestinal system that causes contraction of the intestine that are purgatives, julep, castor oil, cotton oil, etc. Some inorganic irritants are applied on the abortifacient stick that is applied locally in vagina such as lead or arsenic or copper, the metallic compounds. Some vegetable irritants like as unripe papaya seed or Calotropis procera, yellow oleander. Sometimes patent preparations are used such as abortion pills of lead or diphenylamine. General violence with intentional purpose is application of pressure, kneeling, jumping, tight bandage, forceful massage, even kicking is intentional. Heavy exercise with intention like riding, cycling, running, alternate hot and cold bath of lower abdomen. Also another term is common is cupping. Flaming a light is placed on the abdomen covered with a pot or a bowl. Then air expands due to heat and escapes on cooling the air contact and the pot sets tightly which separates the placenta. This is direct violence. Also some accidental are caused with direct violence like generalized shake-up in advanced pregnancy can produce abortion. Even the ovum is healthy, abortion will not occur. Local violences are available like a syringing by Hewson's syringe, rupture of the membrane, introduction of Uthos paste consisting with mercury, thymol and iodine, pushing laminoria tent or abortion stick, rupture of the membrane by hairpin or nail or any other instrument sharp, dilatation of the cervix, dilatation and curettation, air insufflation, even applying electricity. A main point of application of abortifacient stick or abortion stick, a stick which is thin wooden or bamboo made about 15 to 20 centimeter in length and 0.5 to 1 millimeter in diameter. End of the stick is wrapped with cloth or cotton wool that is soaked with irritant abortifacient agents. This causes complications like local injury, hemorrhage and shock, even perforation of the uterus, perforation causing the peritonitis and also incomplete abortion. Contraventions using the rules to rule the doctors as doctor are liable and will be punished under section 312 to 316 of Penal Code for criminal abortion. There are some legal concepts regarding these sections like section 312 is causing miscarriage with woman's consent. If the miscarriage not causing in good faith will have imprisonment up to 3 years with or without fine or both. And section 313 causing without the consent of the woman will be imprisonment up to 10 years with or without fine or both. And if death occur of the woman, it will be under the section 316. Also some terms as abandonment of infant. If the father or mother of a child under the age of 12 years or anyone having the care of such child, leaving such a child in a place with the intention of abandoning the child shall be punished with imprisonment up to 7 years. This is according to section 317 of the Penal Code. And if the child so exposed or abandoned as a girl child, the person doing so shall be punished with rigorous imprisonment and may extend up to the 10 years of imprisonment. Concealment of birth is another term in which whoever secretly buries or otherwise disposes the dead body of a child, whether the child dies before or after or during the birth, intentionally conceals the birth of a child shall be punished with imprisonment up to 2 years. This is under section 318 of the Penal Code. And if the child who is dead disposed of is a girl child, the person committing such offence shall be punished with rigorous imprisonment with the terms which may extend up to 5 years, shall be liable to fine. There are certain duties in case of the criminal abortion by the doctor as professional duties and legal duties. First of all, as a professional, he must consult a professional colleague, as well as the condition and the treatment of the victims or patient's best interest will be recorded in an available facilities. Preserving the available product related to the abortion will be used as an evidence is also the professional duty under doctor. Legal duties. To inform the police or the authority, otherwise maintain the professional secrecy will be must as a legal duty. The doctor should keep all the information obtained by him as a professional secrecy. He must ask the patient to make a statement about the condition and induction of criminal abortion. If she refuses to make so, we should not pursue the matter. If the woman's condition is serious, must arrange dying declaration. If the woman dies, cannot issue death certificate immediately but inform the police and send for autopsy. Some medical evidences should be collected in case of abortion, like which consists of the examination of the female as well as the aborted material. Samples to be collected are vaginal content pipetted in a clean sterile container for chemicals, drugs or soap, pubic hair, blood, urine and stomach content as sample, blood from the inferior vena cava and both cardiac ventricles, any fluid from the uterine cavity, swabs of the uterine wall and also tissue for histology from all organs. There are certain causes of death in case of criminal abortion. They are termed as immediate cause, early cause and late cause. Immediate causes are neurogenic or vagal shock, hemorrhagic shock, perforation will lead to peritonitis and septicemia, fat embolism, air embolism and amniotic fluid embolism. Delayed causes that onset within 48 to 72 hours is generalized peritonitis in case of perforation by instrumentation, local infection, tetanus, septicemia, toxemia, pyemia from pelvic abscess and thromboembolism. Remote cause that is beyond 3 days are renal failure, secondary infection like meningitis, encephalitis, pneumonia, hepatitis, bacterial endocarditis, embophlebitis, disseminated intravascular coagulation and toxic effect of the abortifacient drugs. Medical legal importance of whole as criminal abortion is it is linked with illegal pregnancy and sometimes followed by unwanted pregnancy. It is a punishable offense and the doctor conducting this conduct will consider as professional infamous conduct and for that professional death sentence will be done by the BAMC. In case of criminal abortion, life of the mother is at many risk and a woman may charge falsely or implicate for inducing criminal abortion. Sometimes abortion may be resultant of occupational exposure to poisonous product that comes under the ground of Workmen's Compensation Act. That's all for today. Thank you. Assalamu alaikum.